Hi, I'm Lynne Ryan. I'm a lactation consultant with the WIC program here in Marion County and in Monongalia County. Welcome to the class today. I want to cover some basic things about breastfeeding with you. We at WIC totally promote breastfeeding as the best way to feed your baby in the most normal way. When you leave here today, I want you to feel that you have confidence to get started with breastfeeding, that you'll be able to get off to a strong start, and you'll know where to go for help. I want to cover some basic points just to kind of let you know ahead of time what those will be. I'm going to start by talking a little bit about what to expect through the rest of your pregnancy with your breast. I want you to kind of know what to expect right after the baby's born and how to get started with the baby in the hospital and get the baby off to a good start with breastfeeding. To kind of take you from that point to what you're likely to encounter once you get home in those first few days at home and those early weeks. And at least get you to the point of having the first month under your belt. Once you get there, you're well on your way. And of course, we are there all along that journey to help you any way that you might need it. Okay, so let's start with your where you are right now with the pregnancy. Most of you have probably had some breast changes with pregnancy. Almost everyone notices something. The most common things that you would have noticed by now would be tenderness and perhaps enlargement, which is usually the first sign that you notice early in the pregnancy. Actually, often, once you've been through it, it's a clue the next time you're pregnant that you might be pregnant again. Oh, my breasts are feeling very tender. So tenderness, perhaps enlargement. Women notice the enlargement to greater and lesser degrees. Then the tenderness usually subsides as you get further along in the pregnancy. You may notice that let me show you with this little breast model. The skin around the nipple, which we call the areola, that gets a little darker during the pregnancy. It's pretty gradual, so you may not notice it right away, but it generally does. If you had a before pregnancy picture and after, you would probably notice that skin had darkened. That's actually a visual cue for the baby. There are also little bumps around the areola area. Those are glands, and those little bumps get bigger with pregnancy. As the hormones of pregnancy circulate and stimulate the breast development, those glands are also stimulated, so that you'll notice they get a little larger. Some women worry that it's something wrong, that there's a pimple developing or something. It's totally normal. It's just glandular development. And those glands have a purpose. They secrete a substance that actually moisturizes the skin of the areola, and it's also a antibacterial substance. So it helps to keep germs from being able to multiply on that skin. So you don't have to wash your nipples off when you're breastfeeding in between feeds like you have to sterilize a bottle. The body takes care of it by itself. When you're about mid-pregnancy, you actually start making milk, the first milk. And we call that first milk colostrum. So many of you are probably at that point already. Usually by the time you're coming to take this class, you're about at least mid-pregnancy. So many of you are probably already making colostrum. You may or may not be aware of it. Some women leak colostrum during pregnancy, and some don't. It's normal either way. So if you're not leaking, it certainly doesn't mean that you don't have milk or won't have milk. And if you are leaking to the point where it's a bother, you may need to actually put a little something in your bra. They make special little pads, or cotton pads are nice. You can wash those, but you may or may not leak, and you may or may not need to do that. But you will have milk. One thing about all this is, once you are pregnant and you have the pregnancy hormones circulating, the pregnancy hormones will be working on your breasts to make milk. Everybody makes milk. So once you have the colostrum in your breast, that colostrum will be there through the second half of your pregnancy until the baby is born. And that is the food that nature puts in the breast for the baby's first food. Okay, so that's why nature begins making it in your breast about mid-pregnancy, because some babies come early. And everyone has milk for those babies as well. When your baby's born, on the day of the birth, at the moment of the birth, you have colostrum ready to go for your baby's first food. And I just want to show you with the doll, and you all have dolls, and you don't have to practice this part now, but you can if you want to. What we recommend nowadays is that as soon as your baby's born, as soon as the baby has been checked out and is breathing okay, and assuming that you're fine, and the cord has been cut, and the baby has been padded dry, that the baby be placed up against your chest. This is something kind of new. We didn't used to do this with babies, but we now know that this is really the very best thing to do with a newborn. And we call it skin-to-skin contact. Now, the babies that, I hope someone has passed out babies in the class for you to have, and the dolls that we use here are undressed. Now, I have one with a little dress on, but to have a baby only dressed in a diaper is the best way to do this, what we call skin-to-skin. Because you actually want the skin of the baby against your bare skin. So you want to open your nightgown and put the baby up against your chest, skin-to-skin. And most of the local hospitals are doing this now. In Fairmont, the hospital where many of you may be delivering, I know they do this at Ruby, I know they do this at Mont General. They do it less often at Fairmont, but if you ask to hold your baby up against you like this, skin to skin, they will let you. It's your baby, and you are the customer. So when the baby's up against you, several things happen. And by the way, we recommend this certainly for anyone who wants to breastfeed, but we recommend it for all babies. So, even if you're sitting there today thinking you're not planning to breastfeed or you don't want to breastfeed, don't hesitate to do this skin to skin with your baby, because it helps your baby in so many ways. One thing that happens right away is the baby usually calms. Now, babies are often crying when they're, been born and been through all that, and now they're away from you and they've been in you all that time, and now they're upset and they're crying, and that's good. We want them to cry. We want to know they're alive. We want to know they're okay. But then once they get up on you, they usually calm. And a lot of times they will lift and look at you, which is wonderful, of course. You've been waiting a long time to see that baby, so this is a wonderful moment. And then often we'll just take a little nap. So that's very often the next thing that happens, is they calm down, take a nap. Now, while the baby's laying there, there's a lot of things that are happening physiologically. First of all, oxytocin is flowing in the mother and the baby. And oxytocin is an interesting hormone. It is the hormone that starts your labor contractions, that takes you through labor. And when the baby's laying against you, the oxytocin will actually help expel the placenta, which is a good thing. The oxytocin will also help bring milk down to the end of the nipple. It's what releases the milk in the breast, oxytocin. It's a hormone that makes muscles contract. And you actually have little muscles around the milk cells in your breast that will respond to the oxytocin release. And just skin to skin causes oxytocin release. So very often a little drop of colostrum will come to the tip of the nipple. So you might look down and see that. It's kind of surprising, but it's interesting. So the baby also will be calmed by the oxytocin that the baby is feeling. Oxytocin is also called the love hormone. It's a very useful, interesting hormone. So the baby calms, the baby probably will maybe sleep a little bit. Within either minutes or maybe as long as an hour, sometimes as short as a few minutes, sometimes as long as an hour, the baby will usually begin to move towards the nipple and towards the breast, partly led by even the scent of the drop of colostrum or the scent that's coming out of the glands around the nipple. So at some point that will happen, but in the meantime, other things are happening to the baby. The baby's temperature will become regulated by being up against you. And this is very important, because that's one of the first things that the baby has to do when it comes out of the womb, is maintain its temperature. So when the baby's on you, the baby will be at a very stable temperature. The baby's heart rate and respiration is also stabilized by being against you. The baby's been listening to your heart beating in the womb all these months, and there it is again, right there against your heart, feeling that heart, hearing that heart rate. So the baby's breathing, heart rate, temperature is all stabilized. And one other interesting thing that happens to the baby and what gets stabilized is the baby's blood sugar. The baby's blood sugar is, again, something that the baby now has to maintain on its own. It's been having a constant source of food the whole time in the womb, but now the baby is cut off from that. So the blood sugar, it's very important that that stays stable. And the baby's blood sugar stays most stable when the baby is calm. And this whole scenario makes the baby calm. Babies separated from mothers often are very upset. And it's one of the things that can make their blood sugars get out of control. So we have a calm baby, a warm baby, a baby with a nice rhythm of heart rate and breathing. And then once the baby's all settled down, maybe had a little nap, wakes up smelling the colostrum, feeling hungry, and will begin to seek on its own to the breast, like all the mammals do. I'm sure most of you have seen puppies or kittens, or maybe some of you live on a farm and have seen a little calf or something. All of the mammals seek their own mother's milk and their own mother's breast. And our babies will do the same thing if we put them near enough so that they can do it. So this is what we recommend now. Now, if you're a breastfeeding mother, when the baby starts to head there, yay, just let the baby go. They usually scoot, scoot, scoot. They're actually using their sense of smell. The smell, the scent that comes from the colostrum and from the little glands matches each woman's own scent. It's the same scent of the amniotic fluid that the baby's been breathing in the womb, been swallowing in the womb. It all matches. The baby will be led towards that scent that it's already familiar with. Once the baby also uses his little cheeks to kind of feel. They sometimes turn, they sometimes bob. They'll use all kinds of little behaviors. They can scoot their little knees, but they move. They have the ability to move towards the breast under their own power, and they'll kind of go and down till they get nearby. Now, don't be surprised if the baby starts just licking. It's not unusual at all for a baby to just lick at the nipple. Sometimes they'll lick their hands and go back and forth between their hands and the nipple. They may do that for 5, 10, 15 minutes. It's not unheard of for a baby to do that for quite a while before the baby finally opens its mouth and goes on. And then there are babies who just go on. So we have there's always like a whole range of the way it can happen. It doesn't have to be one particular way. But the main thing is that you can let the baby do it on its own and just gently, your only real job is to keep the baby from falling off of you. You're going to be laying back, on pillows, so gravity will help hold the baby on. If the baby goes on by itself, usually it's a beautiful, perfect latch. When by a good latch always feels comfortable. It should feel like something, okay, it doesn't feel like nothing, but it doesn't feel like a bad thing or a painful thing in any way. It should feel like a gentle tugging. And the other thing that will happen is as the baby suckles, you will feel that oxytocin really surge and be released, which usually means your uterus starts cramping, okay? Which is good. It's very healthy for you. Again, if the placenta, sometimes, by now usually the placenta has come out, but if they're having trouble, sometimes they will encourage the baby to suckle to have that placenta be expelled. But even once the placenta's out, usually in the early days of nursing, when the baby suckles, you're going to feel uterine contractions. This is a very, very healthy thing for a woman who has just given birth. Your uterus is about this big before you're pregnant. It gets very big to hold a baby, and we want it to shrink back to this again. The breastfeeding, the oxytocin release stimulated by breastfeeding will help that happen. So the other thing that feeling those contractions will do, can reassure you and should reassure you, and if you remember me saying this, I hope it will reassure you that your milk is flowing. Because if the uterus is contracting in response to suckling, the milk is flowing and the baby's getting milk. Okay? So that's an ideal start to breastfeeding, and that's what we really, really encourage you to do. And as I said before, even if you don't want to breastfeed, we still encourage the skin to skin. Your baby will still probably seek the breast. Even if you're not thinking that you want to breastfeed, don't be afraid to let your baby latch and get that early colostrum. Doesn't mean you have to continue. We hope that you do continue breastfeeding, but even if you don't, the colostrum is very beneficial to all babies. Colostrum has so many qualities that the baby needs, so many components that the baby needs. The colostrum is in tiny amounts, and I really want to stress this point because this is usually the first cause for concern in new parents, is they're not sure that there's enough milk there, that there's any milk there, that the baby's getting it. When we're talking about colostrum, we're talking about a teaspoon as a full feed. Okay, your breast won't feel full yet on that first day and in those first few days after birth. They're not supposed to, because the baby's stomach only holds about a teaspoon. So the body only makes about a teaspoon per feed of this very thick, dense, sticky milk called colostrum. The fact that the colostrum is sticky also helps the baby in another way. As the baby swallows the colostrum, the stickiness of it's so thick. It's kind of like if you've ever seen sweetened condensed milk. It's sticky stuff. That's kind of what colostrum's like. And as they swallow it, it actually sticks to their throat and their stomach and their esophagus and the lining of their intestines, and it coats that whole gut. The colostrum actually coats the gut, then puts a protective coating that germs and bacteria can't pass through to get into the baby. So it's highly protective for the baby. And all mammals benefit from getting their mother's colostrum. The other thing the colostrum is and does is it's a laxative. When babies are born, their bowels are full of meconium. And some of you may have had babies already and have seen meconium, and some of you might be surprised when you do see it. It's weird stuff. It's black, sticky, tarry looking stuff, and believe me, it's hard to wash off. It takes a lot of wipes to get that stuff off of the babies those first few days, but it's important that all of that meconium, that those waste products that are in the baby's bowel when they're born, gets flushed out of the baby. The longer they hold on to the meconium, the more likely they will get jaundiced. And a lot of babies do get jaundiced, but it just helps if they don't get jaundiced or don't get very jaundiced, because it's less hassle and less potential for a problem. If they get jaundiced, sometimes they have to get their little heels stuck and bring them back for this and that. So let's try to avoid it. Let's get that meconium flushed out of them. Taking in lots of colostrum will help them flush out the meconium. So you want to keep the baby close in the beginning, feed what we call on cue. So that just means if the baby seems at all interested in eating, we want to feed it. Okay, that's your main job as parents, as mothers and parents in the beginning. Is to just pay attention to the baby and respond to any feeding cues. Okay, so a feeding cue in a brand new baby. Now I'm talking about like an hour-old baby, a day-old baby, a 2-day-old baby. Those really, really young babies, and that the baby is awake. That's a feeding cue. That's a really early feeding cue. The baby is even looking like it might wake up. That's an early feeding cue. So if your baby's like, maybe you laid the baby down, you want to hold the baby a lot, but you don't have to hold it every moment. Maybe dad wants to hold the baby or grandma wants to hold the sleeping baby, or you might want to even lay down the sleeping baby. But if the baby acts like it's going to wake up, starts, its eyes begin to open or starts moving a little bit in its sleep, get it back to mom, get it back on the chest, because it's probably going to want to eat pretty soon, okay? So that's an early feeding cue. Certainly opening the mouth, licking with their tongue is a feeding cue. Trying to suck on, the hand. Some of you may have seen in your ultrasound pictures, even the babies sometimes are caught sucking a thumb in the womb. They practice all this in the womb. They practice swallowing in the womb, sucking in the womb. So they already know how to do these behaviors. So if you see any trying to suck on the hand, or maybe dad's holding baby and he's noticing the baby's trying to, chew on his shirt a little bit. Feeding cue, big feeding cue. Get it to mom. It's time to feed. Okay, so you don't want to miss feeding cues in the beginning. It's very important that the baby eats whenever it shows interest. We don't want to miss opportunities to feed. So eventually babies do cry with hunger and cry to be fed. But honestly, that is a very late feeding cue. And a lot of times by the time they get to the point of crying, they're so upset they can't settle down to feed very well. So sometimes if they've gotten to the point of crying, you need to calm them down before you can even begin to get them interested in feeding. Okay, so holding is always a good way to calm them, holding them skin to skin up against your chest. And I know I keep saying skin to skin, but skin to skin in the early days just means, getting the baby's clothes off down to the diaper and getting some real skin contact, okay? Mother's shirt open, baby between the breasts, and getting that skin touch. There's a lot of nerve endings in the skin. It's very stimulating to the baby. It's stimulating and calming. So it's kind of a contrast there, but both things are happening at once. So it stimulates them to feed and calms them down enough to do so. So I'm going to everything's going well, you're in the hospital, the baby has latched, can feed, you're giving colostrum on cue. What to expect is quite a few meconium bowel movements. Most of the time nowadays, you're home from the hospital by the second or third day. Okay, so that's usually what happens. And it's usually about day 3 or day 4 that your second stage of milk production kicks in. And that will be usually a pretty noticeable fullness, okay? So the first few days when you have the colostrum and the baby's getting, you know, that teaspoon of colostrum or so every feed, your breasts don't feel full. But when you kick into second stage lactation, about 3 or 4 days later, it's usually a very, very full feeling in your breast. Some women less so, but that's okay. But usually it's a very full feeling. Sometimes it's an extreme full feeling. If your breasts are so extremely full when you're, let me just back up a minute and say that there's a common term for this event. Common old-fashioned term is kind of called the milk coming in. Okay, well, that's what everybody used to say. That's when your milk comes in. Did your milk come in? You know, oh, my milk came in yesterday. It's a common way of saying it. And it's a good term, except for one thing. It almost makes it sound like you didn't have any milk till it happened. But you did. And I don't want you to forget that you had the first milk, the colostrum, and then this milk coming in is really your second stage of milk production kicking in. And, you know, some women, when it happens, are so full and uncomfortable that you actually do need to stand in a warm shower or somehow get it leaking a little bit to relieve some of the pressure even before the baby can get on the breast. Because the baby has to be able to soften, get its mouth on there enough to move milk. And the baby usually doesn't have any trouble in the early days when your breast is nice and soft, but sometimes your breast can get quite firm when your milk comes in. So if you stand in a shower and encourage leaking, it'll soften it up a little bit and help the baby to be able to get on a little easier. Once your milk, this fullness happens, your volume will kick up. Your milk volume, the volume that the baby takes in, will increase. So the baby's been taking about a teaspoon every time it eats. Now the baby's going to be taking more like an ounce to an ounce and a half or so. I'm just telling you this for your information. You're not going to be measuring it, of course, okay? There's no way for you to know, what's going out of the breast into the baby. And then you don't need to know, because there will be other ways of knowing, and I'll talk about that in a few minutes. But just, there'll be many signs to you that your milk volume has increased. Well, for one thing, your breasts will feel fuller. Another thing will be that you'll probably see leaking. And most women have way too much milk when this phase of milk production kicks in, and probably have enough milk for 2 babies. And I don't think, unless you're having twins. If you're having twins, you'll have enough milk for both babies. But if you're only having one baby, you're going to have a lot of excess milk for a little while till the supply comes down to meet whatever the demand of your baby is, okay? So, you will have this evidence, this fullness, and you'll have leaking, which will be happening because you're too full, and some of the excess will leak. Most women have quite a bit of leaking from about day 4 or so for a week or 2, okay? So now I want you to know about the leaking, kind of expect the leaking, know that it's something that's going to end. I want you to know that, because I don't want you to think, I think actually some women quit breastfeeding because they think, I don't want to put up with this messiness forever. Well, you won't have to, a week or 2 usually is about, because here's what it is, when your milk comes in, you have about this much milk, your baby needs about this much milk. So it's completely a supply and demand system. Your breast is only going to replace what's removed. Okay, so as the baby takes milk, whatever your baby's taking, your baby's taking this much, your supply will just come down and down day by day until finally the 2 things match. And then your breast will be a lot more comfortable and you won't have all that leaking. And that usually takes a couple weeks, okay? So here's the other thing that's important though about that supply and demand. Once that milk comes in, see, everything up until then has been happening automatically. All the breast changes with pregnancy happen automatically. Your milk coming in on day 3 or 4 happens whether you breastfeed or not. If you don't breastfeed at all for the first few days of your baby's life, you're still going to get full breasts on about day 3 or 4. But from that point on, your body will be looking for a sign whether to keep making the milk. It switches then to what's called an autocrine control. The feedback is within the breast. So if the milk is removed, the body replaces it. And it's completely supply and demand. And the amount of milk that you make from that point on will depend on how much is removed. And it will be driven by your baby as long as you feed your baby on cue. So if you want to have a good milk supply, it's very important that you do just that you feed your baby whenever your baby's hungry, and as long as the baby removes milk, you'll continue to make milk. So as I was I'm getting a little bit off track sometimes myself, but I was trying to let you know of ways that you would know that you had milk and be reassured that you had milk. I talked about the fullness. I talked about the leaking. You'll also know as your baby is drinking, once your milk gets fuller around the 3rd or 4th day, that you'll be able to hear the baby swallowing. We call that audible swallowing, swallowing that you can hear. The first few days when it's the thick, sticky colostrum milk, you don't hear the swallowing. It's too thick. It kind of just coats the throat as the baby swallows it. And once your milk's fullness kicks in, you can hear the swallowing. You will actually hear gulping. Okay, that's reassuring. You know that the baby's getting milk, okay? Other things that will let you know that you have milk and the baby's getting milk. You will feel full. The baby will go on. And by this point, you know, you're 3 or 4 days out now, so maybe you've done a lot of this self-attaching, the baby crawling down. It's always a good way to kind of go back to a good latch, just to let the baby do it by itself. But, you know, by then, you're not always going to start that way. You may be, you know, holding your baby in your arms. And I'll tell you a few things in a little bit about some good ways to hold the baby. But, you know, you may be probably at this point now, you're just holding your baby across your lap to feed. But as the baby's feeding and you start out with a full breast, you'll notice that your breasts soften up. So, you know, you'll hear swallowing. Maybe this breast is leaking while the baby's feeding on this one, so you see milk and you feel like, oh, that breast was really full, and now it feels softer as the milk is leaving it. So there's lots of little evidence, signs, and, you know, little pieces of evidence that milk is there, milk is leaving the breast and going to the baby. You still may feel a few uterine contractions. That's one of the earlier signs, and they gradually subside as the week goes on. Another thing that will happen that will really let you know that the baby's getting a good tummy full is usually when babies start feeding, they feed very quickly, they're drinking very quickly. That's when you hear the gulping, they're thirsty, they're hungry, so they're feeding very quickly. And their eyes are usually open and their fists are usually clenched because they're really working at it. And then as their tummy starts to get full, you'll see the baby gradually begin to relax. Their eyes start to close. Usually they go about halfway closed. And then, you know, they start to see that little fist start to relax and the arm open up. Instead of feeding so fast, like many sucks, because the way babies feed, they have to take pauses in their feed. So they'll suck, pause. Suck, pause. You know, they'll do several in a row and then a pause. Well, when they're really hungry and thirsty, they'll do many sucks, like maybe 20 sucks before they pause. And do that for a while. And then they'll start to get a tummy full, and you'll see they'll start to take fewer sucks and slow down. So as the baby begins to get more and more milk and get full and get to the richer and richer milk, the longer the baby stays on the breast, the higher fat milk they get, so it gets creamier as they draw from the breast. You'll just notice in the baby's body language that the baby gradually relaxes. And most babies, when they are really full and finished with the feed, will come off the breast with their eyes completely closed and their arm completely limp, and they just kind of purse their lips and fall back, and we call them milk drunk. This is what they look like. They're just drunk on milk, and they're just, you know, very relaxed, and that's another really good sign that you have plenty of milk and your baby is getting what it needs. Okay, so it's one thing about breastfeeding, if you're doing it for the first time, you've never done it before, so you don't know really what you're doing. You know, I'm trying to give you right now all the best tips that I can think of to get you off to a good start, but there's no way around it. The first time you do it is the first time, and you're going to feel unsure of yourself, and you're going to have questions, and you're going to perhaps need quite a bit of reassurance, and that's what we're here for. And, you know, all these little things that I'm telling you are just, hopefully you'll remember some of them, and they are ways for you to, you know, kind of hopefully reassure yourself while you're doing it that you know, it is going okay, and the baby is getting milk, and there is milk there. But it is a learned skill and a learned art. And so don't feel that, you know, you're odd because you feel unsure of yourself, or that there's something wrong because you're not sure that things going okay. It's common to feel that way with the first baby that you breastfeed. Most women, I think, do feel a little unsure of themselves and not sure how it's going. And I'm going to give you more tips before I'm finished, how you can really know that it's going okay. But, these are some. Evidence of swallowing, evidence of milk leaving the breast, babies coming off relaxed. You can always at any point pick up the phone and call any of the breastfeeding counselors at WIC. We have at least 4 of us usually working most of the time that are available by phone or for you to come in and get more help if you need it right there in the office. So, your baby in the beginning will eat about every 1 to 3 hours probably, will cue by wanting to suck, or as time goes by, nuzzling at your breast. So just feed on demand. Expect frequent feeding. Expect varied patterns, sometimes feeding very close together, sometimes spacing it out a little bit more. But you can totally trust on your baby to cue when it wants to eat. As long as you pay attention to those cues and respond, you will be feeding appropriately. You can't really overfeed your baby when you're feeding at the breast, okay? Sometimes they'll feed real close together and sometimes space it out a little more, but it all works. I have a sheet, you have a sheet, I hope, that someone has passed out to you, a sheet that shows the bowel movements of the breastfed baby. One thing to look for that will help tell you if baby's getting enough is the black meconium stools that I talked about in the early days. That's the first 3 days in the hospital. Expect to see the black stools, several a day. And then once your milk comes in, the baby should transition to the yellow mustard colored stools. Those yellow mustard colored stools are the best indicator that your baby's getting enough milk once your milk fullness kicks in. And if your baby's not having any yellow stools once your fullness kicks in, which is, again, as I said, usually about day 3 or 4, it's not a sign of constipation. It is a sign that your baby isn't getting enough milk. So we definitely need to see yellow stools. If you're seeing them, good. If you're not, call us, okay? Because we need to work with you and figure out what's going on. So that's one of the best reassurances. If you're seeing the yellow stools, everything is going well. One last thing I wanted to talk to you about is just the diagram of the breast. Very simple, just really to understand that the milk is made in the milk-producing cells, and that's what these grape-like clusters are supposed to be. That's where the milk is made. As I said, there's muscles around the milk cells that contract, squeezing the milk out in response to this baby's suckling. The milk then will travel through the ducts towards the nipple area. Most women have about 8 to 14 openings that the milk comes out of. It's not like there's just one opening in the end of the nipple like a bottle nipple. Babies need to take quite a bit of the breast into their mouth. Many babies will completely cover the areola. Depends on the size of the areola. There's variances, of course, between women. Some babies, you'll still see some, and other babies will take the whole areola in. But it's a big area of breast that the baby will actually be compressing when they're breastfeeding. Okay, well, I hope that gives you a good start. I really do encourage you to call the WIC office if you're having any problems with breastfeeding, or just want to be reassured. No question is a dumb question. That's what we're here for, to give you confidence, to help you, especially with your first baby, but with all babies. We're always here to help you. We can do weight checks. We can help you with positioning and latch if you're having any trouble with that. Breastfeeding should be comfortable. Breastfeeding is a learned skill. So we expect that you will have questions and that you will perhaps need some support from us, and we're more than happy to give it. Thank you for coming today.